Decisions and respond to a crisis. Hello and welcome to Health Digest, your go-to program for timely, relevant and people-focused conversations. I am Ukemre Tokwa. Today we bring you stories shaping health and well-being as we focus on proper health communication, looking at the lessons from the COVID-19 pandemic, the questions surrounding the communications of health information, and the renewed scrutiny surrounding former U.S. health official Dr. Anthony Fauci. Well, we'll also bring you your health update, explore relevant developments in health technology, and share important information on sexual and reproductive health. On that note, let's begin with our health news.
In 2020, the world faced a health emergency unlike anything most people had experienced in their lifetime. COVID-19 was spread rapidly. Hospitals were under pressure, and scientists were racing to understand a new virus. Governments and health authorities introduced measures aimed at reducing transmission, masking physical distancing, restrictions on movement, and later mass vaccinations. But as the science developed, some public health recommendations also changed, and that raised a difficult question. How should health authorities communicate when the evidence itself is evolving? The COVID-19 experience was not only a medical crisis, it was also a crisis of information and increasingly a crisis of trust. The World Health Organization says risk communication is a critical part of responding to public health emergencies. Its guardian emphasizes community early and transparently explaining what is known, acknowledging what remains uncertain, and listening to affected communities. You see, the goal is not simply to tell people what to do, it is to build, maintain, or restore public trust. During the early stages of the pandemic, information about the virus was changing rapidly. Guidance on mask, transmissions, and other preventive measures evolved as researchers gathered more evidence. For the public, however, a change in advice can easily be interpreted as contradiction unless the reason for that change is clearly explained.
Good afternoon, everybody. In the past 2 weeks, the number of cases of COVID-19 outside China has increased 13-fold, and the number of affected countries has tripled. There are now more than 118,000 cases in 114 countries.
That is why health communication is not simply about giving people instructions. It is also about explaining why those instructions exist and why they may change. Vaccines introduced another major communication challenge. As vaccination campaigns expanded, questions emerged around side effects, pregnancy, fertility, and possible long-term health effects. Some claims circulated widely, including claims like COVID-19 vaccines to miscarriage, infidelity, and cancer. But proper health communication requires an important distinction. Now, an allegation raised during a political hearing is not by itself proof of a medical cause. The agency does not mean every question about vaccines should be dismissed. It means those questions should be investigated using reliable evidence and communicated honestly. And that brings us back to one of the most recognizable voices of the pandemic. In 2020, as COVID-19 spread across the world, Dr. Anthony Fauci became one of the voices Americans and the world heard repeatedly. An infectious disease physician and immunologist, Fauci had served as director of the U.S. National Institute of Allergy and Infectious Diseases since 1984. During the pandemic, he became a prominent advisor to the U.S. government and a familiar face at public hearings. But 6 years after the pandemic began, questions surrounding some of those decisions continue. On July 29, 2026, Fauci appeared before the U.S. Senate Homeland Security and Government Affairs Committee for a hearing titled Testimony of Anthony Fauci. The hearing examined issues surrounding the COVID-19 pandemic, including questions about the government's response and Fauci's role in decisions and communications through the crisis. Among the most heated moments was an exchange between Fauci and Senator Bernie Moreno.
Wow. All right, let me tell you who David Schertler is for the audience, because he was ejected by the chairman. He's a high-profile criminal attorney.
Moreno questioned Fauci about the consequences of pandemic-era decisions and repeatedly asked whether he would apologize to people who had been harmed. The exchange has renewed political debates about the handling of the COVID-19 pandemic, but for health communicators, there is another question worth asking. What can the pandemic teach us about medical information, and how should it be communicated? COVID-19 experience demonstrates how quickly health information can travel. So can misinformation. During an outbreak, silence creates a vacuum. And into that vacuum can enter rumors, speculations, and information without scientific verifications. That means health authorities must communicate what they know, they must acknowledge what they do not know, and when new evidence changes in the picture, they must explain why the guidance is changing, because in a public health emergency, trust is part of how the science reaches the public.
Still on Health Digest, let's dive into our health updates. Nigeria and other countries across West and Central Africa are recording renewed cholera outbreaks. The United Nations Children's Fund, UNICEF, says outbreaks are currently active in 6 countries across the region, with Nigeria among the countries recording a significant number of cases. The agency says seasonal rains, flooding, and limited access to safe water and sanitation are contributing to the spread. Cholera is a bacterial infection commonly transmitted through contaminated food or water, and it can cause severe diarrhea and rapid dehydration, and it can become life-threatening without prompt treatment. Health authorities are urging Nigerians to drink safe water, wash their hands regularly, keep food properly protected, and maintain clean surroundings. Now, anyone experiencing severe watery diarrhea or signs of dehydration should seek medical attention immediately. The outbreak is also a reminder that clear and timely health information can help communities recognize risk and take actions early. Now, if you love our news and updates, stay connected to our space through our social media platforms. We are Health Digest 08 on AIT and Ukeme on Air on Instagram, TikTok, YouTube, and LinkedIn. Coming up next, we explore how technology continues to change the way healthcare is delivered. From artificial intelligence and health platforms to tools that support diagnosis, treatment, and patient care, technology is creating new possibilities across the health sector. It is time for our Health Tech. Let's take a look. Technology is transforming healthcare and accessibility one innovation at a time. Now, imagine being blind yet being able to follow every pass, tackle, and goal in a live football match. An Irish startup called Field of Vision is making this possible with an AI-powered active device that allows visually impaired fans to experience live sports through touch. The tablet-sized device features a miniature football pitch with a magnetic ball that moves in real time, mirroring the actual movement of the ball on the field using artificial intelligence and live match data. The device tracks every pass and shot goal, allowing users to feel the action with their hands as it happens. Audio commentary is also integrated, creating a more immersive and independent stadium experience. Technology has already been showcased at major sporting events and is helping make live sports more inclusive. More fans who are blind or have low vision. It's a reminder that innovation isn't just about creating new technology, it's about ensuring no one is left out. In the world of healthcare, if you don't already have the gist, as Nigerians would say, as we speak, there are hearings happening about the 2019-2020 COVID pandemic, and the question on health information, misinformation, is currently at the top of the headlines in the global health space. And that brings us to the question of medical accountability. That is correct. Now, that is a discussion we're going to be having on the Meet the Expert segment here on Health Digest. And who better than to have this conversation with someone who is not just anyone, he's a veteran in the media, the legal, and also when it comes to clinical medical space. You know what? I'm going to allow him, give us his many hats. Though he goes by the name of Paul for a start, I'll have him let us know what hat he's going to be wearing on the show as we speak about medical accountability in Nigeria. Thank you so much for joining me on Health Digest today.
Thanks for having me. Thank you. My name is Philip Orbi. I am a lawyer, a certified human rights consultant with the United States Institute for Diplomacy and Human Rights. And I am the executive director and founder of PUB Justice and Development Initiative. It's a non-for-profit organization that it's basically focused on advocacy. And one of our very key thematic areas is medical accountability. And for us at PUB Justice and Development Initiative, medical accountability is far beyond what readily comes to mind, which is medical negligence. When you talk about accountability, healthcare, what comes to mind is medical negligence. And for us, it is far more beyond the medical negligence.
So in a layman's term then, what would you say medical accountability is? Because everyone's ears are on the doctor. What did the doctor do wrong? So can you break down what medical accountability is in a layman's term for us to start?
Yeah, absolutely. Like I was just trying to say, medical accountability goes beyond medical negligence. It's not all about blaming the medical professionals or prosecuting the medical professionals. It's about, the patient's care, the patient's dignity, emergency preparedness, institutional framework, the regulatory framework for a good medical system to strive and to be able to serve the citizenry. So it's not just medical negligence. How are our health institutions being funded? Are they adequately funded to be able to cater for the populace? Do we have, the requisite medications to be able to attend to, patients? So it's all that gamut of medical, in the medical space. It's not just medical negligence, but also how do we fund our health sector? So when we talk about medical accountability, it goes beyond the prosecuting medical professionals. It's not just about that. It's all about what makes a functional health sector, especially in Nigeria.
Thank you so much for that. You're quite correct with that. Thank you for breaking down that definition to us watching. Yes, so when it comes to medical accountability, you have the policy angle and you also have the governmental angle, like you've rightly said. So in the policy angle, when it comes to Nigeria, we look at the national health insurance, we look at, the public health bills and the likes of those. When we look at the government, we look at the budgets, we're supposed to be getting 15%, but it looks like, we're getting less than 5%. What exactly is being used? So there's so much meat to look at in medical accountability. Which direction will we be looking at, or which direction would you say is the top of the priority among so many factors when it comes to health that need attention?
Yeah, basically at PUB, what we believe is that it's a whole lot that is happening within the Nigerian health sector, and we cannot, do everything all at once. So for me, we need to look at the institutions that are on ground, public and private institutions. How prepared are these institutions to be able to serve, Nigerians? If you take a kind of survey, you will understand that almost every Nigerian has a story to tell when it comes to medical accountability, when it comes to, assessing, health services, either in private and public institutions. And we've had, incidents of people who've really suffered, what seemingly look like, medical, negligence. So each case to me is different. They are not, two cases are exactly the same. But fundamentally, what is key to us at Pub Justice and Development Initiative is the awareness. People need to be aware that they have rights, that as a patient, when you go to the hospital, you have dignity and you have that right to be attended to. Now take a look at our emergency response. We have a lot of cases, even as we speak, if you call for a medical emergency, it's very difficult to find one. And we have a government that is supposed to be responsible to provide the basics, for, such services. So it's a whole lot, and it's a national conversation that I think we should take seriously, as government, as individuals, and as non-for-profit. So there are no two cases that are exactly the same. But ultimately, we need to have a system that is institutional, that is accountable, and that serves the people when it comes to healthcare delivery.
Thank you so much for that. You're right. I believe you're referring to the 2018 Patients' Health Bill, which speaks on the right of informed consent to the patient. But I don't know how many hospitals actually display this to the patients. Most of the time you get your prescription written down in, they say that doctors have the most amazing handwritings, and you just get that and you go to the pharmacy, you get the medication without really understanding, what exactly it is you're getting. So you're quite right in that. I'd like to pick your brain on two main areas, and I'm going to allow you to flow with that. The first thing I'd like to know is the case of medical accountability is one that is not really given the spotlight in Nigeria and in Africa, to be exact. But however, outside the confines of the globe, there is a lot going on, especially right now with the Dr. Fauci hearings that have been going on in regard to the COVID-19 practices, adherence, and the vaccines as well. And there's a leading discussion on health information, misinformation, and I believe that also ties to medical accountability. So I'd like to pick your brain on your thoughts on what is currently going on and the position and the right and the responsibility that our government, the Nigerian Center for Disease Control, has to inform and keep us Nigerians up to date with these happenings. Our life, just like many other countries around the world, was turned upside down, and we were made to do so many things without understanding the full effect. And now we have seen from the hearings factually that some of these things were not consistent. So let's get your take on that from a medical accountability expert. And then I'd like to pick your brain on what is the reason for you getting into this space on medical accountability, which is not a niche in Africa and in Nigeria.
Thank you for that. I'll start with the issue of investigations into the COVID-19. All right. I'll start with the issue of the investigations into COVID-19 that is currently going on in the U.S. Congress.
Yes. And
for me, I think it's not comparable because from what you see from the investigations going on, what it tells you is that the United States government has a system that is accountable, irrespective of the party in power, whether they're Republicans or Democrats, for the fact that they could, subpoena Dr. Fauci to come and testify in Congress, whether I pleaded, the fifth, 100 times or not. From me, it is not too important than the fact that, it is an accountable system, but that is different from, where we come from in Nigeria. You cannot see a situation. I'm not aware of a situation where, medical practitioners or even people, public health officials, are invited to give accounts about, the past dates. So I will leave it at that, the fact that, they are inquisition and inquiry into the COVID-19, and for me is enough, to show that the system is very much accountable.
Today's conversation reminds us that health information carries responsibility. It must be accurate, it must be understandable, and when the evidence changes, that change must be properly explained, because good health communication is now is not simply about giving people information. It's about giving people information they can understand, question, and trust. Thank you for staying with us on Health Digest. As always, stay blessed and not stressed. I'm Okemre Tokwa. Bye-bye.
AIT, sharing the African experience.